Case-based questions on Diabetes Mellitus. Welcome back to Diabetes series. This is the sixth and final video in this series. We have covered everything from diabetes introduction, type 2 diabetes, type 1 diabetes, diabetes medications, to insulin therapy. If you haven't watched those, the links are in the description box below. Today, let's test your knowledge with case-based clinical questions, perfect for quick brush-ups and real-world applications. Let's dive in. Case 1. A 45-year-old man presents to your clinic with a 3-month history of polyuria, polydipsia and unintentional weight loss. He has a BMI of 32 kg per meter square and no family history of autoimmune disease. His random plasma glucose is 250 mg per deciliter and HbA1c is 8.5%. Question 1. What is the most likely diagnosis? Answer: most likely type 2 diabetes mellitus, given the patient's age, BMI and lack of autoimmune history. Question 2. How would you differentiate between type 1 and type 2 diabetes in this patient? Answer: to differentiate T1DM from T2DM, check for autoantibodies GAD, IA2, insulin T8 and measure C-peptide levels. Low C-peptide suggests insulin deficiency seen in T1DM. Question 3. What test can confirm an autoimmune cause? Answer: autoantibody tests GAD, IA2, insulin T8 help confirm T1DM. Case 2. A 52-year-old woman with newly diagnosed type 2 diabetes has a HbA1c of 7.8%. She has no renal impairment and no history of cardiovascular disease. Question 1. What is the first-line treatment for this patient? Answer: metformin. Metformin is the first-line treatment for T2DM unless contraindicated. Question 2. If her HbA1c remains above target after 3 months, what would be the next step? Answer: if HbA1c is still above target despite lifestyle changes and metformin, add a second agent, SGLT2 inhibitors, example empagliflozin, DPP4 inhibitors, example sitagliptin, or GLP-1 receptor agonists. Question 3. When would you consider adding insulin to her regimen? Answer: consider insulin if HbA1c remain high despite dual or triple therapy, or if there is symptomatic hyperglycemia or catabolic features, example weight loss. Case 3. A 60-year-old man with T2DM has been on metformin and empagliflozin for a year. His HbA1c is now 9.5 and he reports nocturia and blurred vision. Question 1. What type of insulin would you initiate first? Answer. Initiate basal insulin. Example, insulin glargine or detamir. Question 2. How would you dose basal insulin initially? Answer. Start at 10 units per day or 0.1 to 0.2 units per kilogram body weight. Adjust by 2 units every 3 days until fasting glucose is in the target range. Question 3. What advice would you give regarding hypoglycemia? Answer. Educate about hypoglycemia symptoms, sweating, tremor, confusion, and advise always carrying fast-acting carbohydrates like glucose tablets. That's a wrap on our diabetes series. We hope these cases sharpened your clinical decision making. If you haven't seen our previous videos on diabetes basis, type 1 and 2 diabetes, medications and insulin therapy, check the links in the description below. In the next video, we'll start with an introduction on pneumonia, then followed by video on case-based questions to strengthen your clinical knowledge. If you have suggestions or what topic we should cover next, drop a comment below. We would love to hear from you. Don't forget to like, share and subscribe to 10 Daily Medical Questions for more medical contents. See you in the next series.